He's from Financial Benefit Services. And we are taping this session so that people, I couldn't get around to all of the locations this year. So this will allow other district employees to view this next week. Summer break, I know they want to go out and view it. So I do encourage interaction during the session, questions, because the questions that you have very well could be questions that others have, but they aren't present and available to ask the questions, okay? So again, my name is Faye Signs. I joined CFB about 6 months ago, and I was talking with one of the teachers here on a situation and asked her, hey, can I come out to your location and give a presentation? So she got me in touch with everyone to come out and give the presentation. There are a few things that have changed regarding contacting our office. The first is the phone extension is 6114, and since there have been some personnel changes in the department, I didn't want employees have to know, who did I call, and they're gone now, who's replaced them. So we have one main extension to employee benefits, the 6114 number, and there's a menu there that you'll listen to. For health benefits, press 1, for 403 savings plan to workers' comp 3, so there's a whole menu. And at any time, you can always press 02, it tells you that, and you speak with a live person. So also, it has a rollover feature that if somebody's on the phone, it'll go to the next available person, so there's no waiting. Also, there's a general mailbox for employee benefits, and there's also one that's set up for workers' compensation and risk management as well. And that is employee benefits at cfbisd.edu. And it goes to several people in the department as well. There's one contact. If they're unavailable or backed up, it does allow others, or maybe they're on vacation or off for the day, it does allow for others to respond to your inquiries as well. Okay? All right. So we're going to talk about open enrollment, but more specifically, what I've been finding when I've been going out to the districts, healthcare reform. And there is a big mystery about healthcare reform. And I'm going to try and give a little bit of information of what led us to where we are now. Because I'm sure everyone was shocked to see the plan design changes as well as the cost increases to the plan. And I'm also going to try and give you maybe just a little bit of glimpse of what you might expect next year. Not that I have any kind of say on the TRS policies, but they are following the guidance and the plan design and makeup which is required by healthcare reform. All right? Any questions? I promise not to, though, talk in language like this. Anybody ever call the benefits department or call your insurance company and they ask if did you get your COB yet, or have you filled out the EOI and all that? I'm not going to use those terms today, because the reason I got into employee benefits was because I made a big mistake in my early 20s that was costly to me, a retirement costly to me. And so I started looking into, exactly what employee benefits are. And Ross will tell you I'm very passionate about employee benefits. And I think most people are really are clueless when it comes to employee benefits. I know my father with Medicare and how Medicare pays, and who do I see, and who's going to pay. He had several types of insurance. Who's going to pay primary and who pays secondary, and what if our child is covered by both parents, this kind of information. So there is a lot of cloud and secrecy out there when it comes to employee benefits. But Ross's company has also come in. I sent out a video today, and his company is the one that produced that video. And I'm from the school of communicate early and communicate often. And even though that video didn't have any additional information in it that hasn't already been dispersed, it keeps the fears at bay of what's going on with open enrollment for the fall. So, okay? So there'll be a lot more communications that come out as we get into July and August regarding group presentations, the web addresses that we'll go to sign up. There'll be email reminders, there'll be voicemail reminders. We'll be using the Blackboard, for the reminders and stuff to everyone as well. So don't worry, you won't miss it. You'll get lots of communications and lots of opportunities to make those changes this fall, okay? So let's talk about healthcare reform. And as I go through these, I want you to keep in mind a couple of things. One, what we've already complied with for healthcare reform, because there have been phases of healthcare reform that the employer and health plans have come in compliance with since 2010. I also want you to think about the possible cost that's associated with some of these decisions. I went to a meeting, too, I want to share with you all. I went to a meeting 2 weeks ago about TRS active care plans. And the active care plan ran at a $143 million deficit last year. Who makes up for that $143 million deficit? That would be all of us. And there are 1,200 districts that are on the active care plan. Now, if you're smaller than 500 in a district, they have to take the active care TRS coverage. Any districts that are over 500, it's optional, whether or not they go on that type of plan, be self-insured, or whatever the case may be. But we did opt 2 years ago to join the TRS active care plans. Now, since then, healthcare reform that's already in effect, pre-existing conditions for children. So when a child is put on the plan, there are no pre-existing limitations for children that are on the plans. Adult dependent coverage to age 26. So if you have adult children, they can stay on your plan until their 26th birthday. And they don't have to live with you. They don't have to be single. They can be married, but they can stay on your insurance plan. Remember, there was a time if you had older children that were on the plan that you had to send in the student certification to always show that they were enrolled in school. Well, see, they've eliminated all of that now. They don't have to be in school. Like I said, they don't have to be living with you. They don't have to be single. They can be married as well. So, coverage for preventative services. And coverage for preventative services also at 100%, no deductible. So when you start reviewing the plans in the book, any preventative services under a health plan are covered at 100%, no deductible. So I encourage you, get your physical done, get your well woman exams done, get your mammographies done, get all of the children's sports physicals, whatever. All of those are covered at 100%, no deductible. All right? We had to remove lifetime limits. I used to work at a place, and the average tenure was about 27 years at a manufacturing company, and there was a $500,000 lifetime maximum. And if you had one serious illness, you could have spent all of that and worked there for your remaining years, and you wouldn't have had any more health insurance coverage. So every plan that's out there has had to remove lifetime limits. Now, I've seen them, before at $1 million, $2 million, that type of thing. But if you're dealing with a chronic or a diagnosis that you'll have forever, like hemophilia, I've seen hemophilia patients go through $2 million in a year. So all of those are removed off of plans now. Changes to medical FSA accounts. Remember when they eliminated over-the-counter use for the FSA accounts? That was a really nice feature. If you had your debit card, you could just go into CVS and you could, and you could, buy the digital thermometer and then the Dr. Pepper, and you could just slide your card and it takes the digital thermometer off, and then you pay for your Dr. Pepper or whatever. But they have eliminated over-the-counter items off of FSAs. Now, that's not to say that you can't get some items through over-the-counter, for instance, allergy medicine. Since I just purchased the over-the-counter allergy medicine instead of prescription because it's less expensive. So my allergist, wrote a letter that I have on file, so whenever that I submit my claims, I get reimbursed for my allergy medicine. So that's not to say that all over-the-counter has been eliminated. It's just you got to jump through a couple more hoops to get it reimbursed now. All right? If you were at risk for osteoporosis and had, weakening bones or something like that, you could get an over-the-counter calcium supplement and your doctor writes you a script, So like I said, there's just a few more hoops that you have to jump through. And then uniform coverage summary. So that's big language for you. Remember there was an email I sent out about 6 weeks ago, and it had the summary attached to it. Part of healthcare reform says that an employer has to provide this model notice to all the employees. And it doesn't matter if you're working here at the district, at another employer years down the road. Everybody has to provide these, as well as the rest of these, but everybody has to provide these notices. And it allows you to take a plan. Let's say that you're married and your spouse has a plan. You can actually do a side-by-side comparison and understand what it is that you're reading so that you can make your best informed decision based on what you're being provided. It's sort of like previously comparing cell phone plans. This one in and out of network and where the range, where the coverage areas was. And the federal government said, no, that's enough. We need people to be able to compare the plans side by side and make decisions. So that's the summary that was provided to you all. Questions on any of that? Okay, so that's everything that we've already complied with. This is what we're going to comply with this year, as well as things that we've done earlier in the year. Medical spending accounts will have a cap of $2,500 this year. That threshold has been lowered from $5,000 to $2,500. So you'll see that change whenever you go to enroll this year. And that's just on the medical, bless you. That's just on the medical plans. Now, on the dependent care, it's still at $5,000, but for the medical plans, it's $2,500. Did anybody notice this year when you got your W-2 down in box 12, there was an amount in box 12 that was for your health care premiums? Well, it was on your W-2s this year. Nothing that you had to do with it this past year whenever that you filed your taxes, but I'm going to get to it in just a little bit. But employers had to start reporting the cost of your medical plan on your W-2. And then there's an additional Medicare tax rate for certain income earners that you have to pay more into Medicare. And then also the unearned income tax. For any unearned income, there's an additional 3.8% tax that you're going to have to pay on that. And before you say, well, I don't think I have any, so we're talking about interest on checkings and savings. If you get any sort of royalty payments off of gas leases, if you have a home that you rent out, any of that is considered unearned income. And you're going to have to pay 3.8% additional tax whenever that you file your taxes. Yeah. Questions on any of that? Well, this is a really quiet crowd. Usually by now I've got somebody outraged. So, in 2014, this is what's going to be on the horizon for all of us. Anybody here, before I get into cost sharing limits, anybody here familiar with HSAs? Anybody heard the term HSA? Do you feel comfortable enough to maybe share what you know about an HSA?
I have one.
Fantastic, fantastic. That's fantastic, really and truly. So HSAs are very much like FSAs, flexible spending accounts. These are healthcare savings accounts. And they're a little bit different. We were looking at trying to roll one out this year, but there's a big education kind of ramp up that you've got to do with it. So HSAs is just like FSAs, where that you designate an amount of money to set aside to pay for healthcare expenses. Now, this year, which I have the limits, I think an individual.
No.
No.
Not with that mark.
Oh, that is permanent.
On the behind.
Ooh, all of a sudden, Mark's on good. Thank you very much. You know, my father's.
Buy more.
Yeah, I was gonna say my father's in watercolor markers. Will that work? Okay, there we go. No. Wait, and I didn't put those up here. Those were already up here. My father-in-law is 91, and he's hard of hearing. Needless to say, at 91. But so he's been at a nursing home facility for about a couple of months, and we bought him a little marker board, you know, to be able to write and ask questions. Well, somebody wrote on it with permanent marker, so yeah. We got there, there's freaking, we're like, it won't come on. So HSAs, for an individual, you can contribute $31.50. For a family, right now, it's $62.50 per year is what you can contribute to those accounts. They're a little bit different in that there is no use it or lose it type of rule, like with FSAs. Because like now I've got a few dollars in my FSA, it's going to be the end of the year, and I got to find something to spend it on. Prescription sunglasses, wow. But unlike an HSA, an FSA has a use it or lose it type feature, all right? HSAs, we are not offering one here, but you can open them at banks, surely the national banks. I have one at a national bank, but a lot of the region banks have them as well. And since I'm not offering it through the district, you would not be able to make a pre-tax contribution. However, when you file your taxes at the end of the year, it will ask if you've made any HSA contributions, and so you get the tax credit at the end of the year whenever you file your taxes. Yes?
Do you mind if I add, HSA Bank is also a great solution, hsabank.com.
Yeah.
That's very simple, very reasonable, but also grow some interest in there for you. So again, hsabank.com is another resource if you're, feel good about doing your banking online.
Yep, that's
Throw
right.
that out.
Thank you very much. Thank you. Also with HSAs, like with FSAs, you can pay for medical, dental, vision expenses. HSAs, you can also pay premiums to like long-term care policies or health plans. Let's say that you left the district and you had to pay COBRA or something like that. As long as it's medically related, you can pay that out of the HSA accounts. And I have friends that have had HSA accounts for 10 years and they've got $25,000 and they're just like a regular savings type plan. So like with a 403B or something like that. So when you get to a particular threshold, most of them are $2,000, you start investing, it starts earning interest, all that kind of thing. But you use it for health care expenses. If you don't need it, then you don't spend it. The only thing about an HSA plan, also to keep in mind, is that you have to be enrolled in a high deductible health plan to be able to get the tax credit for making the contributions. All right? The new limits for next year have just been released, and I do want to find that in here because it has some so that this runs on a calendar year basis. So come January, which the feds just released the amounts. Oh, I thought I brought them with me. It's a little bit of a bump, I'll say. I want to say maybe the individual is $62.50 and the family $64.50, I think. Are you Googling that, Ross?
Yes,
You're a
ma'am.
good man. I don't care what your boss says. The reason I bring up HSAs is with the development and the advent of high deductible health plans, which is that Active Care 1HD that we have. And for it to be a qualified high deductible health plan, it's got to meet some criteria. Right now, you can't have a deductible less than $1,250 on the individual level and $2,500 for the family. And you can't have out-of-pocket maximums that exceed $62,500 for an individual and $12,500 for the family. So if we look at this individual rate right here, since the math is easy for me, that equals your $1,250 deductible and $5,000 out of pocket. That's how you get to that. The limits for next year, $63.50 and $12,500. I have just told you what your total out-of-pocket for the plans for 2014, 2015 plan year is going to be. Because the high deductible health plans have to, in order to be part of healthcare reform, they have to have minimums and maximums for the participants in the plans. So that is going to be your total out-of-pocket maximum for not this plan year, but for next plan year. Now deductibles, it can't be any less than, $1,250. Yeah, we're looking at a $2,400, so they've kind of doubled that. But they're trying to make up that $148 million shortfall as well. And that's how they do it. So I know most of you are familiar with an FSA, but if you're contemplating getting into the high deductible health plan, you might want to look at an FSA, just because there are more advantages. The no use it or lose it rule, and then also you still get the same tax credit for it, and then you can also pay for additional things. I caution though that you can have an HSA and an FSA, but the only thing that you can pay out of the FSA are vision and dental expenses. And that's called a limited FSA. And so that's why I said there was so much education that goes on behind that, that we've got enough changes this year. We were not going to roll that out this year, but do look for that next year. Open enrollment is going to be from August the 5th through the 28th. And the district contribution this year is going to be the same. We all know TRS care, or TRS active care rates have increased. And Active Care 1 plan is going to be eliminated. If you are in Active Care 1 and you do not make an election to move to another plan, we are going to slot you in the high deductible health plan. And do not expect to see new insurance cards until October, because of the 1,200 school districts that will be sending in information for open enrollment. Blue Cross Blue Shield has to sift through all of that, and anyone who hasn't made an election out of Active Care 1, they are going to be slotted into 1HD. So Blue Cross Blue Shield will have a lot of cleanup work to do in September, all right? The spending accounts, the flexible spending accounts, of course, the $2,500 annual maximum. The dental increased 15%. There hasn't been an increase on the dental plan in 2 years. But we are looking at some alternative plans for next year. One of those being preventative care at 100%. Just like the health plans went to preventative care being at 100%, we are looking for a dental plan that pays preventative care at 100%. And the reason for the 15% increase on that plan is right now our loss ratio, meaning for every dollar we put in, we're paying out $1.10. But the reason for that is people are not getting the preventative work done. They're going for the fillings and the crowns and everything else, the more expensive work. So they're not going for those preventative care visits. Also, I don't think a whole lot of people are aware that if you have certain diagnoses, heart disease, diabetes, if you're pregnant, our plan does pay for an additional dental cleaning, exam and cleaning. Because while you're pregnant, the only place that the baby can get calcium is from the mom, and that means from your bones or your teeth. And my twin sister had to get every single filling redone after her first pregnancy. She wasn't taking in enough calcium, and the baby leaches the calcium from the mom. So if you're planning a family and pregnant, go and get your extra dental cleaning. Disability did go up 25%, same type of thing. For every dollar we are spending on the disability plan and sending in for premiums, we are paying $1.15 back out in premiums. And enrollments are going to be conducted entirely online this year. And we will have a schedule that's going out to everyone that shows, which will be camped out at the Technology Learning Center for weeks. And there will be plenty of presentations, and we will be targeting elementary schools particular days to come. We'll be targeting middle schools particular days to come. And so there's no guessing. Everything will be continuously at that one location, so we're not having to go, and you're not having to remember, well, what elementary school are they going to be at today? So everyone is going to be at the one location. And Ross and I sat down last week and came up with those schedules, and they're still in flux. And we also have 2 makeup days that are built in. If you can't see a presentation during your scheduled time, there are 2 makeup days that are scheduled as well.
On your HSA, the follow-up, $3,300 individual,
Okay.
$6,550 for
Ah,
family.
so it was much more than what I first anticipated. So you said
3,300
3,300
and $6,550.
and 6,550. Now, I know you all have looked at some of the plan designs on the high deductible health plan. And something important to take into consideration when you're looking at that plan. No longer is there an individual deductible if you have anything other than employee-only coverage. So if you have employee-only coverage, the deductible is $2,400. If you have employee spouse, employee children, employee family, the deductible is $4,800. It's an aggregate. So for every bill that comes in until you meet $4,800, the plan will not start paying. In the past, it used to be an individual deductible here and an individual deductible there. So if I had my husband on the plan, when I met $2,400, it would start paying, and then if he met $2,400, it would start paying. But if my husband and I are on a plan together, it will not start paying until $4,800 has been met by the both of you. All right? I want to talk about high deductible health plans real quick. And I know that when we look at that plan design, we think, how did we get here? I mean, it's just outrageous when it comes to these deductible amounts. High deductible health plans were brought about to help with an idea of consumerism. Meaning, before you go to the doctor, are you looking at all of the resources available to you instead of just going to the doctor's office. Those of us that grew up in an era of HMOs and PPOs, it really did mask the transparency of what things really cost. You ask somebody what an office visit costs, and they say $20. No, an office visit is more like $100, $150 for a family practitioner, $350, $400 for a specialist. And so, like I said, those of us that grew up in an era where we just paid $20 and we were on our way, it masked the cost. And North Texas is one of the most expensive areas in the United States to receive health care. It's more expensive than Atlanta, Chicago, LA. If it weren't, why would all of these new hospitals, if it wasn't profitable in this area, why would all these new hospitals not being built? And the nice little specialty hospitals as well that cater to birthing centers with cappuccino bars in the lobby and private waiting areas for your family adjoining to your room. I mean, healthcare is very profitable. So, and North Texas is one of the most expensive in the area. But then again, too, we've all kind of just become numb to what healthcare is really costing us. An emergency room, anybody been in an emergency room lately or taken a child or something to the emergency room? It's just outrageous whenever you get that bill in. I went for, this has been a couple of years back, I went for about 2 hours, and they just kind of rehydrated me and sent me back home. I think that came to $4,800 for, so it's outrageous. It's absolutely outrageous. Also part of healthcare reform is the mandate that everybody has to go to electronic records. Private health information has to go electronics. That's why when you go to doctor's offices now, a lot of them are just, keying in while they're in the room with you, which is nice. The only problem with that is, as I was talking with someone, there's an expense added to going to electronic health information, but nobody uses the same type of software. So I was talking with a person where my father-in-law was admitted to the hospital, and since they are a growing hospital that's in this area, and they've acquired new locations, they don't even have the same software at different hospitals. So you can have your labs done here and decide to go see this physician or go over to this facility, because you had to be readmitted 2 days later. Well, they can't get your medical information because they don't have the same software. And it's just like, it's just like a spreadsheet software, I heard somebody mention Lotus the other day. I hadn't heard that word in a long time. But Lotus and Excel and whatever else is out there, sometimes these things don't merge up too well. And that's exactly what we're experiencing with healthcare reform and electronic health information as well. So healthcare reform is very far-reaching. There are a couple of things, too, that we need to put on our horizon. Oh, let me back up a little bit. I didn't mention, I think I skipped the slide. You can edit that, Ross, okay?
Got it. Beauty of-
It's a little bit different view from here. Yeah, let's talk a little bit more about this, I'm sorry. So the cost sharing limits for high deductible health plans, which I told you about, and they line up, coincide exactly with health savings accounts. So if you want to know what your plan design is going to look like, again, like I said, look at what the health savings account limits are for next year. Plans, we have to remove the annual limits. We still have some out there, which is like 50 chiropractic visits per year and those sort of things. All of those have to come off the plans. All pre-existing will be removed in 2014. That's January 1, 2014. So even for us adults. And a lot of times, people have been kind of hesitant to leave an employer because they knew that pre-ex would be applied if they went to another employer. So all of that pre-ex is being removed. No waiting periods longer than 90 days, so when you go to work for a company, you can't have a waiting period longer than 90 days. And participants on a health plan have to be covered for trial research. So whether that be actual treatment or actual medication, trial researches now have to be covered under health plans. And, you know, I go through these and, you know, I'm thinking dollar signs. We have to, every state has to set up a health insurance exchange. Anybody heard that term yet? I've heard a couple of commercials driving in the mornings, and they call it, which I will be sending out notices to everyone, I have to by law, and it's called the marketplace. Texas has said that they are not developing their own exchange, and what the exchange is that I'm an individual and I work for a company that does not offer me affordable health care. I go to the exchange and I can purchase that. Now, affordability is based on a couple of things. Affordability is based on an equation. There's 3 different approaches that the employer takes, and it comes down to 9.5% of your earnings. Are we charging more than 9.5% of your earnings? Right now, that threshold is anyone, and this is on the TRS Active Care 1 HD plan. That premium costs $63 a month. At $8.10 an hour, I am meeting the guidelines of affordability on that Active Care 1 HD plan. That's kind of scary, because you know, if someone's earning $8.10 an hour, can they really afford health premiums? Everyone must be enrolled in a plan, and this is very important. October 1, the exchanges are going to be opening. January 1, everyone has got to be enrolled in a health plan. You, spouse, dependents, everyone. When you file your taxes next year, if there is not that amount on your W-2, you as an individual will be penalized, and you will pay the penalty. It's not much next year, but within 3 years, a family of 3, we computed, goes to about $4,000 penalty. So this August, when we have open enrollment, TRS has said when this part takes effect, where everyone must be enrolled in a health plan, when that law takes effect January 1, TRS is not opening the window for individuals to elect coverage. They are not making it a qualifying event to open the window and have people enrolled. So if you are not enrolled in August and don't incur some type of family change, you will not be enrolled when the new law takes effect. So it's very important to meet with the benefit counselors, ask the questions to them. And automatic enrollment is now postponed until 2015, I found out last week. And automatic enrollment means you come to work at CFB and I don't hear from you that, no, I don't want the coverage. So I put you in the Active Care 1 HD plan. But that's going to be postponed until 2015, automatic enrollment for employers. The pre-X will take place for the employer, which there are individual mandates and then there are employer mandates, and that falls under the employer. So it does not have to take effect until the next plan year that starts in 2014. So all pre-X will have to be removed from plans 9/1/2014. So about a year from now, all pre-X will be removed off of the health plan.
But everyone must be enrolled in a health plan.
Right?
So isn't...
Because that is an individual mandate, and the individuals have to go by calendar years. And that's going to be January 1. Employers, we have to go by what our plan year dictates, and that's going to be September 1 of whatever year this takes effect. Yeah, that's a very good question. Thank you. Any other questions on that? Now, don't kill the messenger, okay? So a couple of takeaways for you this afternoon. One is, look at the medical plan that you're currently enrolled in. How many of us are still on the same plan when we first came to the district and haven't really looked at the medical plans? I usually get a few hands up on that one whenever that I'm talking to people. And, you know, look at what you're truly spending on health care. I know that $2,400 or $4,800 really sounds like a lot for a deductible amount, but the difference in the price of the Active Care 1 HD and the Active Care 2 plan is $200 a month in premium. And so I had someone asking me, and you know, all of our utilization is different, so I cannot tell you what plan to take, but I can give you some guidance. On the 2 plans there's a $200 a month premium difference. If you are spending $200 a month on health care or prescription medications, then maybe Active Care 2 plan is the way for you to go. If you are not spending $200 a month, then maybe you look at Active Care 1 HD. However, if you have planned surgeries, know you're going to have a baby, this type of thing, sit down and figure out in advance what those expenses are going to be. Each of us have accounts at BlueCrossBlueShield.com, Blue Cross Blue Shield, BCBSTX.com/TRS. And we can see what we've spent this past year, as well as accounts out at Medco or Express Scripts. We can see what our medications are costing us. I was looking for an eraser, pardon me. And if you know that you are going to have expenses this year that are comparable and you're not spending, okay, got me a little nervous now. If you are not spending $200 a month in healthcare, then you might want to look at the 1 HD. But you have expenses, and this is what I do whenever that I go to look at it. I always use myself as an example. So I take a couple medications every day, and those cost me $12 a month, all right? And then the dentist loves to see me come because I always have to pay the deductible. I always need a crown, or the dentist loves me. And so I usually factor in about $500 for the dentist. And I'm on the vision plan here, but I do have a $10 copay, and they pay up to $130 for frames. So I usually try and factor in about $50 for my eyeglasses. And since that's $744, I would just round up and I'd make it $800. And that's what I would put in an FSA account. And that way you know that you've already taken into account what you're going to spend, because, yep, I got to take that medication, I'm going to go to the dentist and have my cleanings done, and I'm going to throw in some extra money as well. If nothing else, to round it up to $1,000. You know, I have to go to the doctors once a year for sinus and allergies. That's $100. So that's how you start planning for your FSA accounts. If you're starting a family and you know that the global, I have to tell you, when I first started doing employee benefits, a global fee for a delivery was $3,000. It's $8,000 now, $8,000. And that's just the OBGYN. That does not include the facility, the anesthesiologist, I see I got a head nod there. It doesn't include the anesthesiologist, the pediatrician, the blood work, lab work, all of that. So you're talking a good, I'd say $12,000 to deliver a baby. Am I getting close?
Yep.
Yep, okay. So whatever plan you pick, if you know that you've got those expenses, with that $12,000, you know you're gonna have $2,500 in expenses you're gonna have to pay with that global fee of $12,000. Go ahead and take that $2,500 and put it in an FSA. An FSA is an interest-free, tax-free loan. And what I mean by that is, September 1, that $2,500 is gonna be loaded on your MasterCard. And so it is interest-free. You've got that sitting there, and you can spend it all September the 2nd. I've had 2 tendon repair surgeries, and believe me, the next day after it's on the car, I've been getting surgery on there. So it's interest-free in that I have my procedure done, and then I just pay it back out of my check over the next 12 months. Tax-free because it's being taken out of pre-tax. So an interest-free, tax-free loan for me. All right, questions on that? The deductible is per calendar year. So I take that back, per plan year. And our plan year, I've just switched all of them to coincide. So our medical, our dental, and our vision are all gonna run on a September 1 to August 31st plan year. So when you meet that deductible for the first time, now do not go to the dentist on August 15th, people, okay? Because September 1, you're gonna have another deductible to meet. So when you meet your deductible anytime after September, it is met until next August 31st. But it's only on the first charges that come in. It's not every time you go to the dentist. Once you meet that $50, you're done for the rest of that plan.
Okay, and is it for Cigna, was it $50?
That's correct. Yep, that's correct. And there's a $1,500 a year maximum that the plan will pay. So, and I encourage you all too, I've been noticing a lot of the utilization on our dental plan, we are not going in network for our dental care. And something for you to consider is like when I have to have a crown done. Well, I just had a crown done, and I chose a physician that's in network. Now, the regular price for a crown is about $1,000. And if you go out of network, the plan, you gotta pay your $50. Let's say that the deductible's already met, but you have to pay 20% of that. So your copay, excuse me, that's not correct. You have to pay 40% of that because that falls under the 3 category there. So your portion is going to be about $400 for that crown. Now, if you go to an in-network doctor, that means that they have contracted with Cigna to accept their negotiated amount. So instead of that $1,000 that they're going to charge, the price is now about $800 instead. And then you pay 40% of the $800, which is $320 versus $400. Does that make sense? And so you want to make sure on the health plan, on the dental plan, and of course VSP, that you are finding in-network physicians. Now you can go out of network, but it's going to cost you more money. And with the payment here on this one, Cigna has paid $600 towards services, and here they've paid $480. So your $1,500 is going to go further as well, because they're only going to pay $1,500 a year. So your $1,500 goes a little bit further. All right, make sense? All right. So takeaways, look at what medical plan you're on. Make sure it's the right one for you, that you're not paying too much in premium, that you're comfortable with the deductible amount, that you're comfortable with the RX copays. You will see in our books, too, I want to point out one thing about the RX copays. On the plan, the plans pay, you have a copayment of $20 for generic medications. Anybody think that's a little high? You may consider going to a Kroger, CVS, Albertsons, and they have lists of about 200 to 300 different generic medications that they charge you $4 for. So if you are sending it through the health plan, that medication very well may be on those lists. Don't always send your medications through the health plan because you could be paying too much for them. Make sense? Yeah, right. And I also downloaded the mobile app when I was at Kroger the other day, where that you can actually scan in your prescription and get it refilled, and all of the pharmacies have these features. You can also set them up on automatic refills. Express Scripts does that as well too for our home delivery. You do not pay that $20 generic copay for the home delivery of your medications. So you have them delivered 3 months at a time to your door, and you pay a fraction. That's why I pay $12 a month. I have them delivered to the house. So, all right. Take a look at the level of disability coverage that you have. A lot of us signed up for disability whenever that we first came to the district. Maybe we're making more now, and we really haven't adjusted that. Or since the premiums are going up 25%, take a look at how much you're insured for. And let's say that you're making $40,000 a year, and you're insured for 70%, I'm gonna round it, 70% of that. And all you really need every month is, if you were not at work, you need $2,000 of income to come in to pay your bills. You might wanna bring that back a little bit so that you are paying less premium. So 2 ways to look at it there, okay? If you did have to do total salary replacement, you want to look at the level that you're currently insured and make sure you're insured for enough. If you want to kind of lessen the blow of the rate increase, think of what your monthly expenses are and get covered for that much, all right? I told you about the extra cleanings for certain diagnoses when it comes to health plans. Also, get your preventative care done. Zero copay, pays 100%, no deductible. Get your preventative. Everyone knows that treating a condition or diagnosing a condition is much easier to manage when it's at the early onset rather than when it gets to the catastrophic phase. So please, get your preventative care done. And then, of course, the medical FSA changes of $2,500 a year. Okay? Any other questions? It looks cold on this side of the room. These things are like whipping all around. All right, that's all I have. Thank you all very much. I appreciate you coming this afternoon.